about being a doctor, being a nurse, being an oncologist, or being in palliative care, and one would take a lot of pride at saying that well, I've set up this facility on palliative care. That would be a matter of pride. But in one's own personal life, caregiving is pretty much a very thankless job.
Family caregivers are the invisible pillars of society and healthcare. They are critical for the healing and well-being of patients. 60 to 80% of family caregivers are women, and their work is unpaid for or taken for granted. The complexity of this problem is that in India, while non-communicable diseases contribute to 80% of the burden, only 20% of state financial resources are allocated towards them. More than 190 million individuals need long-term home-based care. This is a burden that family caregivers, mostly women, must bear. Unpaid care restricts their ability to access higher education, employment, and healthcare services, especially mental health support. Now, long-term care is stressful, lonely, and unpredictable. Caregiving is personal, unique, and dynamic. Caregivers need seamless access to a variety of personalized resources in order to stay healthy, productive, and resilient. This leads to poverty of time, money, compassion, and even dignity. We are living in times of digital technology and AI that can enable 10-minute quick commerce. Then why not easy access to health and care and gender equity? My initial goal of the leadership project was to enable fundraising for an enterprise. However, over time, I believe we can leverage technology to help reimagine care, caregiving, and rebalance unpaid care work for gender equity. My name is Bhavana Issar, and I have been a caregiver for more than 30 years, since my teens, and was 25 when I lost my very fit pilot father to a degenerative terminal illness. Caregiver Sathi is my ikigai. As a passionate motorcyclist, I believe navigating uncharted terrain is not just an adventure, but my life purpose. Reimagining care in a systems thinking approach has meant going beyond the diet of the patient and the caregiver, in understanding all stakeholders, influencers, and beneficiaries in the dynamic context of culture, business, and technology, for designing programs that will keep the system functional, balanced, and evolving over time. This framework includes simultaneously enabling skilling, the care economy, compassion in practice, and leveraging technology. It is a toolkit designed for advocacy for family caregivers at the policy level. In a paper titled Human-Centric Information Systems, Research on Digital Future of Healthcare, Caregiver Sathi was mentioned to highlight the significance of including caregivers in future research. Some of our programs include documenting 200 plus stories, contextualizing caregivers at the workplace through thought leadership. Future Fit Corporates are conversations that shift the narrative from giving accommodations to caregivers to valuing caregiving experience for the unique perspective, competencies, and leadership that enables innovation and resilience at the workplace. Empathy enclaves are deeply immersive experiences to sensitize future caregivers. Finally, to navigate these programs, a minimum viable product of a digital platform is ready. And the next steps are identifying investors to enable customer adoption at scale as we fine-tune the product market fit. Normalizing conversations around care, caregivers, and caregiving in diverse settings like summits, colleges, and clubs has led me to be honored to receive the Distinguished Alumni Award from XLRI School of Business in its Platinum Jubilee year this year. My leadership journey has led me to grow by tapping into my masculine and feminine sides to balance structure, technology, economic viability with creativity, inclusive engagement, and continuously zooming in and out to align with the larger vision of shaping a caring society beyond a business enterprise, constantly challenging my thoughts and pushing the boundaries of my mind. Most importantly, redefining my relationship with time, money, and investors. WomenLift Health has given me the opportunity to be reflective and access brilliant leaders who have helped shape this project. I'm looking forward to engage with other alumni, partners, and the organization for extending the network, building alliances, and partnerships for testing the platform across geographies. In an ongoing effort, a leadership think tank of diverse participants comes together regularly to design experiments. The larger vision is to reimagine care for all, bridging the compassion deficit. While compassion is a perishable resource, it is a renewable fuel and a learnable skill. We need robust systems. Thank you.